Joe's already introduced me. So I work with the Research Design Service North East North Cumbria. So I'm just going to give you a whistle-stop tour about what the RDS is all about and how we can help you when you're beginning the process and taking your fellowship application all the way through to submission and hopefully success. Okay, so the aim of the NIHR Research Design Service is to increase the number and quality of applications for applied health and social care research that benefits patients and the public. So in the past, what would happen is lots of people had some really great research ideas, which never came to fruition, either because they didn't know about opportunities for funding that were available to them, so they just never applied, or they did find opportunities to apply, but they didn't know what funders were looking for in an application, and so their applications were not competitive, which is frustrating both for the researcher and for the funder. And overall, it means that good research ideas are not taken forward, which is a waste for all of us. So the Research Design Service there is just there to level the playing field so that everybody has access to the support information that they need to be able to submit a really good quality application for funding for your research ideas. We operate right across England, across 10 regions, and hopefully you'll be able to see where you are on that map. They are quite big regions, so for example, the North East North Cumbria straddles coast to coast, the very top of England there and down into Yorkshire. It's a free service and genuinely free, that there's no catch. You can access us as much or as little as you want, and it won't cost you any more or less. It won't cost you anything at all, in fact. We are confidential, so we don't share your research ideas. We are impartial, so we're not there with any particular agenda other than increasing the quality of the application that you put forward. And we are advisory, so we're not there to be part of your research team or to tell you what to do. We're there to offer advice and support, and then it's up to you as the researcher at that applicant to decide what to do with that information. We are for anyone who's designing an applied health or social care research for a nationally competitive funding stream, and that covers academic, clinical, third sector and small to medium enterprises. And we can support people from their first grant right up to the big programme grants. We support predominantly NIHR research, because that's who fund us, but we also support the applications to research councils and the Association of Medical Research Council charities as well. So we support applications right across the different programs for research, so not just fellowships, but we do support the fellowships from doctoral right up to professorial. And we have an established relationship with the funders, particularly NIHR. So we work with them quite closely to understand what happens within the funding panels. We observe the funding panels to see how the panel reacts to the applicants and what sort of questions they have and what sort of things swing it in terms of something being successful or not. And all the advisors within the RDS are active and experienced researchers themselves. So we very much feel your pain when you're putting forward an application. We know what it's like. And essentially, we're there to take you through the process of turning a research idea into a research proposal. And we can do that in a number of ways. There's a number of different ways that we can support you. It's absolutely tailored to you and what you need. So if you're very confident about what you're doing and you don't really need much support, or, aside from peer review, that's absolutely fine. But if you need your hand held from the very start of having a research idea, we're happy to do that too. It's entirely up to you. So the first step, I guess, is if you have an idea for a research project, is to go and look at the literature and understand what's happened already and situate your project within that. Obviously, we've discussed several times within this session that it's for a fellowship application. It's not just about the project, so also to think about you as a person and who's going to support you and what your training would look like as well. We can talk to you about appropriate funding streams. As I say, we cover the breadth of the NIHR funding streams and beyond under the medical research councils, etc. The fellowships straddle quite a wide variety of types of different research opportunities, and we can talk to you about whether a fellowship is right for you at the moment, or whether actually you need to do a little bit of work before you get to that stage, and whether, for example, you're better to go for the IGA route, as Dave discussed earlier, or the DRF route. We can have all those discussions with you. We can bring other people into those discussions as well if that's helpful. We can talk to you about study design, so how you're actually going to do your research and what the best design for that is, and to assist you with that, we can also bring in our specialist advisors. So all research design services work with specialist advisors across their region who have specific expertise in some of the areas that you might need to put your application together. So typically, a lot of people will ask for support from statisticians or health economists, qualitative researchers, clinical trials, but you can see there's a lot more. This is just what we have within the Research Design Service North East North Cumbria, and actually it's probably wider than that once we drill into it, but all the RDSs will have access to these advisors, and we just bring them into your meetings to discuss what you want to do, and they're able to give you very specialist support to make sure that your application is as robust and methodologically sound as possible. We can talk to you about feasibility. So is what you're planning realistic, both within the kind of the frame of what you're applying for. So is it appropriate for a PhD project? But we can also talk about whether it's something that's actually doable. If we think that maybe it's not doable, or we have questions about that, it's likely that your funders will too. So it's worth paying attention to that. And we might suggest that you go away and look at more literature, or collect more data, or speak to some patients and public about what you're proposing to do, but we can advise you around that. We do have specialists, of which me and Joe Lally, who's our chair today, are specialist advisors around patient-public involvement, and we'll talk to you about what that actually means in terms of it being meaningful and appropriate. So absolutely not a tokenistic involvement. This has to be true involvement that's seen right throughout your application. The NHR defines public involvement in research as research being carried out with or by members of the public rather than to, about, or for them. And they talk about active partnerships between patient carers and members of the public with researchers that influences and shapes research. And PPI will be different depending on what your project is and what you're hoping to achieve. So somebody like myself or Joe can talk to you about what it is that you're wanting to do, and talk to you about what potential PPI avenues you might pursue. The funders will look for the PPI that you have in your run-up to your application, but they'll also want to see how you're going to involve patients and the public within your project if it's funded as well. So we can talk to you about different models that could look like. We can also talk to you about things like costing. As Heide mentioned earlier, that's really important to get right. And there is also an opportunity to apply for additional funding and resource to support PPI activities. We do recognise that actually it's really difficult to get PPI off the ground when you don't actually have any funding pre-application, and so we do have funds available, which we can talk to you about and point you in the right direction. And we also facilitate access to lay review. Now, this will vary by the research design service that you're attached to, but for example, at the Research Design Service North East North Cumbria, we have a consumer panel, which is a panel of research interested lay people who will review applications, look at plain English summaries, have online virtual meetings with researchers to give a kind of general lay view on what they're proposing, and we facilitate that access for researchers. And if that's not appropriate, we can talk about different ways that you might approach that. We'll talk to you about your research team, and in the context of a fellowship, obviously we'll be talking about your supervisory team and all the things that everybody's talked about today that are important to see within that, and if there's gaps in that, we might suggest where you might go elsewhere or how you might add to your team. We'll talk about any ethical considerations that we can see within your grant. Obviously, there's no point in designing a study that isn't ethical. It's never going to be funded, so it's really important to pick up on those issues. And often, again, your PPI will help with that in terms of understanding what is and isn't appropriate within research settings. And we'll talk to you about impact as well. So I think that's been mentioned quite a lot this afternoon. It's really important that you're able to articulate how your project is going to benefit NHS and patients and the public. There is information on the NHR website about impact. It is really important. You don't necessarily need to kind of change the world for your PhD, although I know everybody would like to, but you do need to have a very clear idea of the trajectory to impact. How is this going to come into practice and change people's lives for the better? Other ways we can support you is by peer review, looking at how you've written your application. Hopefully we won't have this face when we're looking at your application, but it's really important within an application that you're really clear, that it reads clearly, that there's a good narrative there, that it's really clear to the person who's assessing it, what is the issue here and how is it that you're going to address it, and why are you the best person to be able to do that, and we can advise you on that and help you to tweak that and so it looks the best it can. We can signpost you to other people who can help you. So for example, the CRN, if they're looking at your costings or looking for research support within your application once funded, so we can signpost you to the right person within your region to speak to you about that. We can talk to you about costing, about what would be expected within that. And again, we would be working with our colleagues within places like the CRN to make sure that that's done properly. And then we offer teaching sessions. So such as today, we offer a range of teaching sessions on different aspects of research design and applying for grants. And your own RDS website will have details of what they're doing, but we're increasingly doing these kind of cross RDS works. Since they're virtual, there's no reason to restrict it to your local area. So watch out for different opportunities that come up from us. When you request RDS support, so this is just an example from our regional RDS webpage. There's a contact button on there that you can just press and it brings up a form that you just fill in as much detail as you want. Even if at this stage you're just thinking, well, I have a bit of an idea, but I don't really know what it would look like, that's fine. Even if your query is, I don't know if this is eligible for funding, or I don't even know if I'm eligible for RDS support, it's absolutely fine. We're all very friendly. If you fill in that form, we'll get back to you and clarify how it is that we can help if we can. With an RDS, once you request that support, you're allocated a general research methodologist who will take you all the way through your process up to submission. You'll have a meeting to discuss the specific circumstances of your application, what your needs might be in terms of specialist support, whether you want to have sort of monthly meetings or whether you just want to touch base now and again. We'll provide that ongoing support. You'll submit your funding application. If you're successful and have interviews, we can support you around mock interviews. We've had a discussion about that. And then you'll get your funding. As Sam and Vicky have alluded to, you don't always get your funding. And if you don't, then we can support you on that as well and look at what your feedback was and how it might be that you can craft that into a subsequent application. So it doesn't just end there. So in conclusion, the Research Design Service is funded to support you. We're literally here getting paid to support researchers to put these applications in, so please do make use of it. It is free of charge if you're developing a grant application to an open national peer-reviewed funding programme. We do support the tailor the support to your needs and what you need out of that. And as everybody has said at every presentation, I think today, the best thing to do is to contact us as early as possible. So please don't come to us, don't spend a year working up your application and then come to us 2 weeks before the deadline, because it's really difficult for us if we then are suggesting major changes that you're not going to be able to incorporate. And I will say that we are kind but critical. So where we feel that an application maybe isn't ready for submission, we would tell you that as well, because as I say, our remit is to make applications as robust as possible, and where we feel something would benefit from a delay, we would let you know that. So the contact details are there. You'll get these slides afterwards, so I won't dwell on that, and I'll just stop now because I know that people will want lots of time for questions and answers.